St Mark's Hospital. Preparing for a colonoscopy. To prepare you for your procedure, a patient information leaflet will have been sent to you. If you need an interpreter at your appointment, you may have already arranged this when you saw your GP or during a pre-assessment interview on the telephone. But if not, please contact the endoscopy reception ahead of time. Please be aware that a relative cannot act as your interpreter. To allow a clear view of the colon, you must be completely free of all waste material. You will have been sent a packet of bowel preparation and a separate information leaflet in the post, or you may have been given one when you made your appointment. The bowel preparation acts as a laxative, clearing your bowel of feces so a clear view can be obtained during the procedure. Within 3 hours of the first dose of bowel preparation, you should expect frequent bowel movements. It is advisable to stay at home the day you take the bowel preparation and stay close to a toilet. On the day of your procedure, if you feel the bowel preparation has not worked for whatever reason, please let one of our nurses know. Additional preparation or an enema can sometimes be given to avoid rebooking the examination. What about your regular medications? Please do not stop any medications before your procedure unless you have been advised to do so. Please make sure you bring an up-to-date list of all the medication you are taking when you attend for your appointment. If you are taking antiplatelets, warfarin, or any other anticoagulants for blood thinning, you should have been advised if these need to be stopped before your procedure. Aspirin does not normally need to be stopped before endoscopic procedures. If you have not received advice or need guidance, then please contact the pre-assessment team. 7 days before your colonoscopy, stop taking iron tablets until after the procedure. 5 days before your colonoscopy, stop taking antiplatelets, warfarin, or any other anticoagulants if you have been advised to do so. Stop taking any constipation medicines. Continue taking all other medication unless you have been advised otherwise. If you are taking lithium, please contact our pre-assessment team. If you take blood pressure or heart medication, please bring this with you on the day of your test. Do you need to bring someone? If you choose to have sedation, it is essential that you arrange for a responsible adult to take you home after the test. This must be someone known to you and not a taxi or a minicab driver. If you do not make these arrangements, we may have to cancel the procedure. It is important that you have someone stay with you overnight because of the effects of the sedation, and that you do not drive, return to work, operate machinery, sign any legal documents or drink alcohol for 24 hours afterwards. Choosing sedation means you may be in the department for a little longer. Your escort should ring the department's telephone number before coming to collect you. Please ask them to ring after your appointment time so a collection time can be agreed. Arrival and pre-assessment. When you arrive, you will be booked in at the main reception. A nurse will take a medical history, explain the procedure and answer any of your questions. Please make sure you bring an up-to-date list of all the medication you are taking when you come for your appointment. We want to involve you in decisions about your care and treatment. A doctor or nurse will explain the procedure and you will be asked to sign a consent form giving your permission. This states that you agree to have the treatment and you understand what it involves. You will be admitted and asked to wait. This may take some time depending on how busy the unit is, and we will try to inform you of any significant waiting times. You will need to undress and put on a gown. Lockers are available for your personal belongings, but please do not wear jewellery, bring valuables or a large amount of money with you, as the trust is not responsible for any losses. If you usually wear nail varnish, please avoid it when you come for your appointment, as it can interfere with our ability to take accurate oxygen readings. You will be taken into the procedure room and placed in a comfortable position on your left-hand side.